Hello everybody, it's Thursday again and it's Alex and Naomi from the infant feeding team at the John Radcliffe Hospital in Oxford. We are in the maternity hospital here and we are doing our usual hour questions and answer session on infant feeding. So if you have got any questions that you'd like to direct to us about feeding your baby, so that could be a newborn, it could be you're pregnant, it could be that you're weaning, bottle feeding, breastfeeding, expressing, anything at all that you feel that you would like to ask us about questions, please do join us, put your questions down there and hopefully we can answer them. Hope you've all had a good week. I think we've been as busy as normal and had our usual busy things going on in the wards, so hope your feeding's been okay. If it hasn't, then come back to us and talk to us and ask us if we, see if we can help you. I think things are getting a little bit back to normal, so you're able to go out and do stuff. So I'm not sure how many people will be watching today, although there is a bit of a gale blowing outside, so I'm not sure many of you will be out there doing a lot. But if you have got questions about scans or you've got questions about your pregnancy that isn't to do with infant feeding or appointments or visiting, then please direct it to a different forum. There is a Ask the Midwife session, I think, every other week on a Monday, but also your own midwives or the website, the Women's Centre website, can be accessed and just on Google, the JL website, and then you can find the right information. Things are changing all the time, so we are midwives, but we don't know the answer for every department, so hopefully you can find the answer that you do need as you need it.
I might need to go get my charger for my laptop, believe it or not. We thought we were prepared, but we're being moved, we're on the move, our office is moving. So.
We're going right up into the clouds, into level 7, so that's going to be our home now. We've been on level 4 for the last few years.
Yeah.
And so now we're going to a different place, so we're clearing out and doing all of that, and we've been in clinic this morning as well, so hopefully we're still going to be able to answer your questions and things as we're going along. So what are we going to talk about today? We thought to talk about paperwork. So just so that you're aware of the paperwork that you have on the postnatal ward, so that you can be in charge of your care basically. And when you have your baby, you get a care plan like this, which is really helpful. It's got lots of information in it for the midwives, but also for you as well. It's a joint thing. So you take this home with you when you've had your baby. You don't get it before, so it's nice to know what you're going to get when you've had your baby, and this gives us lots of information on here. So apart from having your details on the front, it's on here, it's got all of your midwives' contact details on, so if you're not sure how to contact the area that you live in, that number is there that you can contact your midwife. So, and there's at the bottom there's a little scan, the QR code that you can get in for co-sleeping as well, so that will be helpful, and you might find that helpful to look at while you're waiting for your baby to wake up. And then as you go through, it's got about you here, and then there's a page there that we write all the checklists that we do. So when you're having your tummy checked and all of that sort of thing, we tick the boxes there, and also we put your baby's weights and poos and pees and things like that, and feeding and how it's all going.
Yeah, so that's mum and that's baby.
Check. So you can check those as well for the midwife, what she's written. And then on page 6 it says baby feeding chart. Congratulations on the birth of your baby. It's a red and white page. This is for you, and you can fill this in. So it's got questions that you can answer. I've got my glasses on so I can read it out. So it's got about how well your baby's feeding. So it's got licking around the nipple but not attempting to latch, or displaying cues if you're bottle feeding, rooting at the breast and attempting, struggling to suck, swallow and breathe if you're bottle feeding, rooting and attaching with a not such a good suckle, or if you're bottle feeding, able to suckle or swallow and breathe with minimal dribble, or rooting, attaching with a strong suck, or effective bottle feeding. So that's on there, that's a list of things that you can look at, but also your midwife will ask you about. And you can look at that and think, what are you doing? How is it working for you? how is the bottle feeding going? Because it's as important, bottle and breastfeeding, you should get the same care with whichever feeding you choose to do, and you should get support on how to give your baby a bottle as much as you will if you get support to breastfeed as well. And so that's very important. And then when you have had when you're feeding your baby, then you write the time of the feed down and how you thought it went. Was it suckling well, or was it not really attaching at the breast, so that the midwife can see what's been happening. If she hasn't been helping you, she's not been with you. And then you talk about your pees and your poos. So tick when your baby's had a wet nappy, and is it wet enough? And then put a thing down to say your baby's done a poo and what colour it is, because that tells you an awful lot about how your baby is actually doing. And if you look over a period of time, you can see that your baby's pooing frequently, and that's what should be happening. Your baby should be pooing frequently in the early days, and certainly for the first 6 weeks should poo every day, at least twice a day.
I think going back to that box, this box here that Naomi's mentioning, this one here, if anyone's got their care plans, you'll see, and Naomi mentioned about the licking. I think a lot of people don't think all babies are born and know how to breastfeed. They don't, it's a learned skill. Yeah. And it takes time for both mother and baby to learn how to breastfeed. And licking is the first thing they do. So a baby that is getting ready to be able to breastfeed is going to be a baby that's going to lick around the nipple, and that's a really promising sign. So if you've got a baby that hasn't just gone straight off and done it, which many babies don't, but they're beginning to lick around and sort of familiarise themselves with your breast, then that is a really important stage, and it's part of that stage process. So don't anticipate that your baby necessarily will be born and go straight to the breast in the first instance, because not all babies do.
And they certainly can't get food if they don't lick. If their tongue's not moving in and out, they're not ready to feed. And it's really difficult to give babies, say, syringe feeding. You shouldn't be giving them mature milk in a syringe. You should only be giving colostrum in a syringe to your baby. So it's not a great way to feed your baby if you're giving it milk in a syringe if it's more than colostrum. Partly because if they're not licking and they're not suckling and swallowing, they may inhale it if it pools in their mouth and then they cry. So we recommend that you, looking at what your baby's doing, stimulating and, moving. If your baby's going to the breast, that you're moving the nipple down the top lip to encourage them to open their mouth and put their tongue out, and then they will take the breast into their mouth and they will learn to suckle. And the tongue darting will start, and they'll salivate, which will help with them wanting to breastfeed or bottle feed. And if you're bottle feeding, then you run the nipple, the teat, down the top lip in the same way, so that they will put their tongue out and gape in the same way. And that's what that's talking about.
We've talked about the global health videos many times on these programmes, so you can go and have a look online, do a search for global health media videos, and they follow, if you look at the breastfeeding in the early hours, there's a lovely baby, well, there are 3 gorgeous babies, but there's one particular baby that is literally licking and salivating on its hand before working out, but then it works out how to do it to the breast, and that just shows you what the baby's doing with their tongue and what they need to be able to do in order to get onto the breast. And that's a brilliant example. If you watch the global health media videos, they're superb.
And when your baby is born, particularly if you haven't had any medication, so that the medication in terms of things like epidurals, or you've had, one of the morphine-based injections, then you will find that your baby is much more alert when they come out, because they do get very sleepy from having medication. So it does make them much less responsive in the early hours of being born. But certainly babies that haven't had much medication, or haven't had recent medication, will through you, not in labour, but through you in labour, they come out, they're much more alert, and they will be really alert and licking their lips and looking for food and bobbing their head. And you can see that on those videos. You can actually see what your baby should be doing on those videos, and that will stimulate them to then approach the breast and attach to the breast, because they're doing all the things they should, salivating, tongue darting, and then sticking their mouth open and gaping to get the nipple in their mouth, the breast in their mouth, and that's what they're working towards. So babies won't feed if they don't do that. They're not interested. So that's what you're looking for when you have your baby with you all the time, and the more you have your baby on you, so that's where they expect to be, skin to skin, close to you, they will play out those behaviours. They will do those things if they're with you, close to you, and they can smell you. If they're in a cot wrapped up in a blanket in a warm room, they won't won't play out those resources in the early days in the same way. So we encourage you to have your baby skin to skin and be switched on to what they're doing, because you're likely to miss the cues if you don't. And that's really important for the early days feeding.
Totally agree. Should we do some of the questions?
Yeah.
So, well, I might have to be on the phone, but I've got my computer's working at the minute. So, Charlotte's come on. She said, "Hi, ladies." She's one of our frequents.
Hello, Charlotte.
Hello. And she says, we hopes we're having a good day. Alicia's asleep, so she's not waving today, so we don't need to wave back at her.
We won't wave her, we'll be quiet.
No. She's had the last 2 days she's been teething. Can we give some tips on the best soft top bottles, as I'm trying to get Alicia to hold her own little bottle? Sorry to keep asking questions. We never need you to say sorry for that. We're happy for any questions you come up with. Can't always promise we can answer them, but we're very happy with the questions. I have to say, when it comes to soft top bottles, I'm not the expert, and I don't know about you, Naomi. I think it's a case of going and having a look.
Some people say the sippy cups are quite good, which are sort of at an angle. It's
Doily cups, the other ones, aren't they?
The other one, yeah. And I think things move on very quickly in terms of what babies use to feed. So we probably are a bit out of date in those things, because as we go shopping and look for them for ourselves, which isn't very often, then we won't know what's on the market at the moment. So you're probably better off putting it out to a WhatsApp group, or somebody else maybe on this forum can write and answer your question. They may have found something really good, because there's always something coming on the market which is, the perfect opportunity. But I think that just try a cup as well. That's always a good one. If she's she's a big girl now, she can drink from a cup.
I know, it's lovely when they can go straight onto cups.
It's messy. You've got to be very brave as a mother when you've got babies, because they spill everything and throw it all about. But you've got to just pretend it doesn't matter for a bit, so that they become.
Some of them
confident.
don't spill, do they? I think so. Those we brand,
cups,
they're like Anyway Up and things like that. But actually, they're quite hard for the child to get the milk or whatever they've got in it, and quite hard to get it out. But there are so many on the market. I don't think we've.
Or just bottles with straws in. The bottles that you can get with a straw. They can learn to suck with a straw very easily. Maybe
someone who's watching might pop something on there.
Yes.
Marie has said, "Good afternoon. We started baby-led weaning with our 6-month-old baby. We tried to introduce cow's milk last week by giving him full-fat yoghurt 3 days in a row. Well, on the second day, he started to have some reflux once or twice a day after a feed. And since then, he's had that once a day. Who should we ask advice about that? Thanks a lot. Because of your advice, we had a great breastfeeding experience with my son since day one."
Well done you. Hopefully still going strong.
Yeah, keep that going with the breastfeeding as well.
Breastfeed first, and then give top up of food after that.
Yeah. Your health visitors are probably a good person to go and talk to about the bringing it up. Obviously, children do bring some food up. That's not that uncommon, but obviously, if you've seen a particular relation between what you're giving and what's happening, it's probably worthwhile having a quick chat with your health visitor or your GP.
This might be the increased volume of food in their tummy, and they're just full. So it just might be that's what's happening, rather than anything to worry about.
And remembering that breast milk is unbelievably easy to digest by the baby, and all the other foods take a bit more getting used to, which is why we wait till 6 months, because they've got the ability then and the right enzymes in their stomach to actually break foods down, which is why we don't do it any earlier. Because when our children were younger, we were getting them onto solid foods much younger, and it really was a waste of time.
12 weeks. Yeah,
Far too early.
In and out.
Far too early. They didn't have the motor skills. They didn't have the skills to take it.
Came out, went in, you spooned it, went back in.
And then and all that happened in the end was you displaced milk, so much better to do what you've done and hang on till the 6 months, which is a recommendation. So I think have a chat with the health visitor maybe and see what she says, Marie. And I'm so glad feeding's gone so well for you. And it's really nice when you put a comment up like that, because for those that are new to the feeding journey, whether they're still antenatal or they've just had their babies, it's lovely for you to say here that it's gone so well for you, because often all we hear are the horror stories. So it's lovely to hear when it's gone well. Moving down to Joanna, she says, "Hello lovely ladies, I have a question about my 13-week-old baby. From a few days while feeding, he started latching, turning his head and going back to latch for a few seconds, unlatching again. I've no idea what's going on. We never had problems with feeding like that. He's been diagnosed with reflux when he was 7 weeks old and got omeprazole. I'm also dairy soy free from 3 weeks now, and it seems to help a little bit. Unfortunately, he's still uncomfortable when feeding. He's also eating his fingers a lot now, but I don't know why he's unlatching. Will you be able to help? Just to confirm, him being uncomfortable is normal, not that I'm, oh, it's just dropped. Bear with me. And so where is it? Not normal that I'm happy about it. Unlatching is not. So unlatching is not normal is what she's saying. Being a bit uncomfortable is normal. So
it's quite difficult because they get quite hungry at 12, 13 weeks, and they have a bit of a really big growth spurt where they feed, and they're awake day and night for quite a while. So it could be a week or two that they're a bit unsettled at that time. So it may be that that's coinciding with it. You haven't started your periods or anything like that, or anything's changed, you've gone on to any medication, so that it could just alter your milk supply at all, any hormonal medication. And I think that, they become more aware of what's going on around them outside as well, so it may be that he's a bit distracted with some things. Have you tried feeding him in a quieter room with no radio or television on and nobody around, so that he doesn't just kind of come off to find out what's going on? They are very easily distracted and will be on and off looking.
very aware of their surroundings, aren't they?
Is he teething? Because sometimes they have earache as well. If they're teething, they're just generally a bit uncomfortable, and babies don't know how else to communicate with you when they're a little bit uncomfortable. So it might be that he just feels a bit uncomfortable, and his gums are a little bit sore. It could be lots and lots of different things, but it might be worth getting your health visitor to check and just seeing what's happening. I don't know when you've next got an appointment with your health visitor, if he's having his vaccinations or has he just had some. Sometimes that makes them a bit uncomfortable after they've had their vaccines, and it just changes their pattern of feeding and sleeping for a little while. Lots of different things really, but if everything's just the same, then you probably need to be talking to somebody just to check and get somebody to see what's happening.
Yeah, that's a good idea.
Let us know.
Imi's come on and says hello, Alex and Naomi. Hello, Imi and Leo. Hope you're both well. So, and she's come back and replied to Charlotte. She says, cup's called Sip. It's an open cup, but has good grips so babies can use their hands to guide it to their mouth. So that sounds like a good idea. And Charlotte's come back and thanked her. Hannah has said, hello ladies, we had our baby girl Ruby at 36 weeks and she is now 16 days old. After a few days on level 5, whilst there I bombarded the amazing staff with constant questions about latching and feeding, etc. And aside from prolonged jaundice, Ruby is doing really well. We've had a good start at the breastfeeding, but last few days I've been experiencing a lot of pain and being uncomfortable in both breasts in between feeds. Bathing and warm flannels do help, but does this sound normal? All previous advice I was told Ruby's latch was good and I use different positions. Will this discomfort ease with time? Possibly just someone need to have another look actually, Hannah, I think. Just check, and it's amazing how we always say about it, a millimetre here or there will make the biggest difference to your feeding. It might just be that you are keeping your wrist as you're bringing her on, you're moving your breast. It could be that she's just that little bit bigger. She's grown and you're not allowing for that and bringing her around. So, it's remembering, Name's going to grab the pictures, it's remembering
Make sure you line her up correctly, because sometimes if you've got her on the end a bit too much, you overstimulate. And did you do any pumping in the early days? Have you done lots of pumping and sort of pulled back on pumping suddenly? Because sometimes that's just, you've been putting the order in and your milk's now decided how much you're going to have, and it might be that you've just got a little bit much, but it sometimes means that you're putting your baby in the middle rather than lining your baby up asymmetrically on the breast, so that you're lining your baby up much lower than you think to the breast, so the nose is opposite the nipple and the chin is really underneath the breast tissue here, so that they breastfeed rather than nipple feed. If you've got them round here just on the end, so you're going like that, can you see, like that instead of like that, which is very different if you can see that, not like that, because if you're on the end like that you're going to overstimulate your milk supply. It's just going to be on off on off. That is going to drain your breast and allow the breast to make the next feed, and so you will empty your breast or drain your breast well, and then you won't be quite so overstimulating. And so it's really important that you line your baby up correctly in order to do that. and then when they go to the breast, they put their head back, and the chin leads, and the nose is free. So they get a really big mouthful, and that nipple just skims the top gum, literally just skims the top gum, and it goes right across the roof of the mouth to the back of the throat. And then the baby will take in a big mouthful of breast on the tongue, and it should stabilise the nipple in the mouth, right at the back of the roof of the mouth, you know, almost at the throat, and the milk just goes down the throat, it doesn't pool in the mouth. So they drain the breast really well and get food as they want it. They're not really meant to get food in their mouth. It goes right down the back of their throat. It doesn't sit in their mouth. So they don't cough and splutter if the baby's got the breast right in its mouth properly. But if it's sort of on the end of the nipple, they will cough and splutter quite often when there's a large amount of milk in the breast. So maybe you're finding that. But it's just really important that you line your baby up correctly. There's a different picture, so that might just see it differently. But
that's my favourite picture.
It's very, very clear what you need to be doing. You know, you're not holding the head, the chin is leading, the nose is free, and you're asymmetrically going onto the breast.
So I was just going to put the picture on there, so it's saying that this is where the pressure's going to be down here, that mother's going to bring that baby on and push them here, and that this baby is not going to tip, this baby's going to come straight on. They're going to come on like that, so this upper lip's going to carry on, and the chin's going to go further into the breast. So this baby isn't doing this movement, it's just coming straight on. I remember saying that to a colleague, saying, I want you to get the baby to go straight, and it took her a while to work out what I meant, so I know it's not always intuitive what we're saying. People think,
but you don't want to nosedive.
No.
Because I think that's what people do, isn't it? Let's have a little baby. Going to ruin my... Oh, we didn't see that, did you? So you're putting your hand on the back of your baby's shoulders here, so your baby's head is free, but this part of your hand, the heel of your hand, is right on the shoulder, in between the shoulder blades, and then your baby is lined up, nose to nipple, and you're taking your baby straight up. You're not hooking it like that, because that's nose diving. You're going chin first, so your baby is going straight up onto the breast. So there's literally that action. There's nothing like that, which is what people want to do. They want to hook, but it means then that the nipple is going on the tongue, not on the roof of the mouth. So you've got to imagine that the nipple is going into his nose, literally into the nose.
Joanna's come back. She says, hi again, I haven't changed anything, no period yet after birth. He does seem a little bit unsettled during the day. Hard to say, because he was never a good sleeper. The only naps 40 minutes.
Doesn't want to miss out.
Still seems happy after, so maybe it's just a growth spurt. Thank you, I'll contact my health visitor just in case. I think that's probably worth it, because they get to this very alert stage, don't they, Naomi? That
they just want to see what's going on. You know, if you live in a busy house,
so
you want to know what's going on.
Naomi's putting the babies back, that's what she's doing. There we go.
Just in case you were worried.
They both survived.
There we are.
their ordeal. So let's just bring this back. Right. Whoops.
There are babies.
Might borrow your cup actually, Naomi, and pop it behind. Sorry, folks. Put it there.
Technical issues.
Yeah.
We think we'd be good at it by now.
I know, we've been doing it so long, we think we'd have no problems.
No.
But it's been as we said, we're moving office, it's been a funny day, so I haven't brought my charger, so my laptop's going to pack up on me any minute now. So, right, so that was, I think there were some questions, let me just check whether anything else that came in there. And
it's amazing, isn't it, how you get to 13 weeks so quickly. And you think, oh, you can't wait for the next phase, but actually enjoy the phase you're in, because it goes so quickly. And I know people think when they're breastfeeding that it's a lifetime, but exclusivity is 6 months, which is such a tiny amount of time. If you think about what's happened in the last year and how quickly that's gone, having a baby for 6 months and exclusively feeding your baby for 6 months is such a small thing to do, but every day it feels like a lifetime.
It does,
when you're struggling.
So I think we were answering Hannah's question there. So Hannah's the one who's got a lovely baby Ruby, who was born at 36 weeks and 16 days old. So I think that's looking at positioning attachment again. Then Hannah, just make sure you've got it absolutely spot on.
And if your baby's 36 weeks, they might have been very sleepy. So I think congratulate yourself on the fact that you've got loads of milk.
Yeah,
that's really, really, really fantastic, because that's the hard bit. if you've got milk, you can do anything. So if you've got lots of milk, you can work on your attachment. And remember that at 36 weeks, I know he's a little bit more than that now, but he was a little bit early, and they don't feed in the same way. They can be quite babies of that gestation, so 35 to 37, 38 weeks can be quite deceptive in the way they transfer milk, and they look like they're chugging away on the breast and they're not actually doing very well. They just look like they are. So that's why we always talk about topping babies up if they're born before 37 weeks, so that you're absolutely reliable on their intake, because they're not reliable at suckling at that age. So he probably hasn't suckled as well as you think, because he's a little bit younger, and it might be that he's not draining the breast as well as he could, and that makes it even more important to get that attachment.
So get some help. 16 days, obviously.
So we all talked about topping them up when they're in hospital, didn't we? Making sure that they got lots of food, and that's until you're absolutely certain that he's gaining weight without being topped up.
All right, good luck with that, Hannah. I hope it gets lots better. Marie's come back and said, thanks a lot, ladies. That's very helpful. Yes, breastfeeding's still going great. Thanks again, and good luck to all the mums. Yeah, so brilliant. Leanne has come back to tell Charlotte there's a cup called the Doidy cup, which is on an angle, so the little one can see the liquid in the cup all the way to their mouth, so it saves any spills. And then they've been around a long time.
Yeah,
I remember the Doidy cups, Leanne.
And they're nearly 30, so they have been around a while. They're great little cups.
Yeah, I hope you're all right, Leanne. Nice to see your name up there. Rose has come. I think we've met Rose as well. Her little girl's 5 weeks old now. She had a 90% tongue tie, which she had cut at 2 weeks old, and has healed well. She's combi fed, and she had IGT, which is insufficient glandular tissue, for anybody out there doesn't know, and low supply. So that's where perhaps the breast didn't grow quite as much as we would have thought. But she's still clicking on the bottle and taking hours to feed. I've tried different bottles and teats, but this hasn't made a difference. She's also developed a real breast aversion, which is quite heartbreaking, and will cry hysterically when I try to latch her. Could this also be linked? She's gaining weight, but we seem to spend half our day on and off the bottle. You poor love, Rose. That's really hard work.
Perhaps you could ring us.
Yeah,
Perhaps you could ring us.
Yeah.
We could do something like using a supplementary, a nursing supplement, so that there's no bottle involved. I don't know if you know what that is, but basically it's a little tube like this, and that goes onto your breast.
Do you hold it?
So you just hold it onto the breast like this, and the baby then sucks out of the bottle, and it's like a straw basically. So they never get a bottle in their mouth, so that they learn to find milk from the breast rather than the flow from the bottle, and that's often why they get really angry, is that the flow is different.
Yeah.
But if they get a present at the breast, then they change around and tend to be happier. So it's something we could look at with you. If you give us a shout, we could talk you through.
I was just looking at your name actually, and I think we may have met you before. So just give us a shout. Maybe a breastfeeding clinic.
Make sure that tongue tie hasn't come back. Because is it there again if it's got worse again? If things have got worse, it might be that sometimes about 4 or 5% of tongue ties grow back. So sometimes they get worse feeding again. So there's lots of things that could be going on there that you perhaps ought to talk to us about, Rose. Give us a call.
We may not be able to get back to you today if you ring us today, because our telephone's even been unplugged and moved. So apologies if anyone's phoned us. We're going to take a while to get back to people. There's 2 of us in tomorrow, so hopefully we'll manage it then. But so, yeah, I think that would be well worth giving us a call, Rose. I think and your 5 weeks, you're still within our remit. Because if anyone's wondering, we are able to carry on offering support up to 6 weeks. We're very happy to talk to you on this at whatever age, on the telephone, by email at whatever age. But we can't bring you into clinic after 6 weeks, unfortunately. Then you come under. She's going to call us a call tomorrow. She's just said. Then you come under the health visitors if you're over 6 weeks. So, but under 6 weeks, you're with us. Charlotte's come back just saying Alicia's woken up and she's watching. Should we give her a wave? Okay. Any tips on clearing out Alicia's ears as she's teething? Also, Alicia has a 1 year jab on the 28th, and I'm just worrying about her as I'm needle phobic. Even though she's the one who's having it, I just want to be a great mum. Alicia, Charlotte, you are a great mum to Alicia. You've been fabulous, and I think that when you go and have her jabs, they're going to be perfectly used to many mothers who are needle phobic, and the staff there will support you. With regard to her ears, I suggest you speak to your health visitor, because that's certainly not where my skills lie.
Nothing smaller than an elbow.
That's what my father always used to say. Nothing smaller than an elbow in your
They're
ear.
Self-cleansing.
So, Hannah has said, thanks so much. That second picture with the chin really helps. Thank you, ladies. It's a good one. That's my favourite.
Yeah.
We've laminated them. We love them so much. Right, we did read out Johanna's second bit. So she said she hadn't changed anything, no period yet after birth. Does seem a little bit unsettled during the day, but it's hard to say because he was never a good sleeper. Only napped 40 minutes, but still seems happy after. Maybe it's just a growth spurt. Thank you. I'll contact my health visitor just in case. So
they do an awful lot at 12 weeks. It's, it's a really big time, and that's what all the calibration was when you had your baby in the first few weeks, was calibrating for 2 weeks, for 12 weeks. 12, 13 weeks. So this is the sort of thing that you've been working towards for the last 3 months, is this period of time where there's a huge change in their milk intake and how they feed and the milk volumes, but also the composition of the milk changes as well. So certain components become more as their growth spurt to prepare them for the next level. So lots and lots of changes going on, and he's probably just waiting for it to happen. And it takes about 4 days to change a milk supply. So if he's waiting for it, it will be happening soon, I would imagine.
Brilliant. So Amy's just come back. Just a quick one. How many times should I be breastfeeding Leo now? He's only having 3 during the day, only when drifting off to sleep, and is still on and off the whole night. Well, that sounds probably enough. I mean, he's over a year now, isn't he, Amy? I'm sure, isn't he over a year now? I'm trying to remember. I remember meeting you downstairs.
It's like we're talking about the first 6 months. It happened so quickly. That, a year.
So I think it's whatever he wants alongside other foods. That's absolutely fine. I mean, if he's feeding on and off through the night, he's probably getting quite a lot then, and then offering him whatever he wants in the day. It's being responsive, meeting his needs. And
does he take solids happily, or is he breastfeeding predominantly and having breast milk, or because actually food is his priority now, and breastfeeding comes after it now that he's 1. So always breastfeed whenever they want it, but actually food is for fun before 1. And
he's
then
9 months.
9 months.
Not
So
great
food
at
is
solids.
For fun. Food is for fun still.
Don't worry about it, Amy. Don't worry. Just let him have what he wants.
Yeah.
And just go with him. He's been brilliant. You've both been brilliant. It wasn't great. It wasn't an easy start, but you've come on so well. I mean, that's fantastic. I was thinking it was nicer weather. Well, it was nicer weather, full stop, last year anyway. I was thinking about when you were coming in, it was quite warm.
And is he doing what he should be doing? I think that's the important thing, is he happy with that?
Well, I've seen a few pictures of him recently. He's just gorgeous. He's lovely. I get the occasional picture sent through, which is lovely. So I've met him since he was tiny. So anyway, I think don't worry, Amy. Just let him tell you, and just offer him those foods and see what he wants. As Naomi said, food before 1 is just for fun. Alicia has come on. Do you have any tips for weaning off using a nipple shield? My little girl is a month old, but due to flat nipples, I've been having to use shields from the start. Tried to latch halfway through after taking the shield off, but baby still struggles to find the nipples. Sorry if my question appears twice. I'm not sure if I sent it the first time. Don't worry, and if you did, we won't worry. But, well, one of the things we always say, isn't it? The nipple shields, coming off nipple shields is totally and utterly up to the baby.
It's not up to you.
Yeah, you can't make that happen. You can offer them the opportunity to go on without them, but it's only going to be when your daughter is ready that she'll do it.
And plastic is their driver, because that's what they learn to use to feed. So when you put a squishy, soft breast in their mouth, they have no idea what to do. So you can either put the nipple shield just near their mouth when they're going on. That's one way of doing it, so that they root for it, because that's their driver, and then you can get the nipple into their mouth. But the other thing is you can make a sandwich with your finger and your thumb, and you can really just make your breast really firm and hold it. So when you're putting your baby on, you keep your fingers there, you keep your fingers there, you keep your fingers there, so it's firm, so it feels more like a nipple shield in their mouth. They have no direction if it's really soft and squishy. But if you firm it up like that, they will often just stay on and keep suckling.
Add compressions in.
Yeah, add some compressions. But the other thing is to let them just literally get the flow going and start to glug, and then literally whip. You've got your breast here. You whip it off. I always say stick it on your chest there. Put them straight back on the same breath, so they don't realise they're so hungry. So don't leave it too long. Halfway through the feed is probably too late, because they're not so hungry. But if you let them have 3 or 4 suckles just to get that flow and start the glugging, whip it off literally as it's in their mouth, just pull it out their mouth, put it on the top, and then make a sandwich, put them straight back on the breast, and they probably will start to suckle if they're ready to do it. But they'll only do it on their terms. They'll only do it on their terms. It might be tomorrow, it might be in 8 weeks' time, it might be in 6 months, but they will do it when they're ready. Often they do it when you've left them at home and you go out and you have no choice.
And I think the other thing to say is that, you know, whilst it can be a pain to be using nipple shields, it's much better to have a baby at the breast using a shield than not at all. Yeah. And as long as you have an established milk supply and your baby is meeting their milestones with regard to weight and poos and wheeze, then we don't worry about it. You know, I've heard people saying, but it's, you know, it's cutting back on the milk. Well, we worry about them in the first few days. The first few days, it can have a huge impact on your milk supply. So anyone who's watching who hasn't had their baby or their baby's in the early days, please avoid nipple shields in those first few days.
Don't let anyone tell you you've got flat nipples.
Yeah, your baby has never met a breast before. You know, if you look at the versions we have here, you know, look how different they are, and this is what life is like. We are all different, and your baby has never met a breast before, so your baby will deal with whatever you have. So once born, as long as they aren't introduced to a bottle or a nipple shield in the early days, the only thing they're going to know about is your breast, and they will deal with it. So, you know, ideally try to avoid anything other than your breast in the first few days. And once your baby's learned how to do that, then actually if you need to give them a bottle later, then that will probably work. But if you give bottles early on or nipple shields early on, then your baby then struggles because they don't really get the breast. But going back to you using a shield, if that's the way your baby feeds, then it's much better than you sitting there pumping all day. Having a baby at the breast feeding is, it's still a baby feeding, even with a shield. And I know they're annoying because they flip off, babies knock them off, you need more hands, but actually your baby is breastfeeding, and that's fantastic.
And, you know, if you think you've got flat nipples, go and have a cold shower. See what it looks like afterwards, because they're probably not going to be flat afterwards. Yeah. You know, nobody's got flat nipples, it's an erectile tissue. So, you know, as soon as they're stimulated, which what a baby does is they lick it and they pull at it with their fingers, as you know, and then your nipple comes out. And that's why we like babies crawling and bobbing on the breast and licking, because they prepare the nipple to feed. Yeah. So don't let anyone tell you you've got flat nipples, because all the nipple does is put milk in the mouth. The breast is the bit that needs to go in your baby's mouth to feed. It's breastfeeding, not nipple feeding. So the nipple goes right to the back of the throat, and the breast is in the baby's mouth, and the tongue is milking the breast, not the nipple. If it's milking the nipple, you'll be saying, I've got sore nipples, and you won't be doing it. So you want to stabilise that nipple right at the back of the throat, and so it doesn't matter if it's sticking out or not. It's the breast that needs to be in the baby's mouth.
We've had mums come to clinic and they've had an inverted nipple and an everted nipple, so one that sticks out and one that goes in. And the baby will go on the one that's in, but won't go on the one that's out. So it just shows what babies get used to. So the likelihood is when that baby was born, it went on the inverted side first, and then was presented with the everted, so the sticky out one, and the baby goes, well, what's that? That's not what I had last time. So, you know, just shows babies will deal with what they've got. So don't look at your anatomy and go, oh, or let anyone else tell you, oh, you'll be fine, as long as your baby doesn't get given something else.
They don't know anything else. We get really cross about that, if you have a guest.
We have a few hot topics, don't we?
We do.
Fiona has come on. Just another quick question. My 5-month-old has recently started sleeping really well at night time. Don't tell everybody. Which is brilliant. However, she only feeds once during the night. Is this going to affect my milk supply? Should I be waking up to pump in the night? She still wants to feed a lot during the day. As long as it's not too long. It depends how you're feeling as well. I mean, we normally say no more than 6 hours, don't we, Naomi?
I think she's having lots of feeds in the day. She's making up for the ones that she's not having at night. And if she's reaching her milestone, so she's gaining weight and she's happy and peeing and pooing normally, then that sounds normal. But if she's sleeping 12 hours, she's got to catch up for 12 hours. She's going to be busy in that 12 hours. She's not going to be sleeping very much in that time.
I think you're worried about your supply, though, aren't you, Fiona? It's going a long time. You could do a dream feed. If she's sleeping that well, you might be able to. I don't know what time you're putting her down, but if she's going down reasonably, to mid-evening, and she's not then waking till sort of early morning, then actually you could, if you're going to bed a little bit later, get up and offer her a dream feed, and that will just at least keep the milk moving in your breast. Because you obviously, if you go a long time without milk removal, you run the risk of blocked ducts, mastitis, and reducing your supply. So that might be worthwhile trying. And amazing how babies will do a dream feed. It's incredible. You just pick them up, offer them the breast, and they look like they're fast asleep, but they will feed. And just keep that milk moving in your breast. Might be a way of doing it.
If it's 6 hours, then it's probably fine.
Much more you might be concerned about, I think. But yes, everyone else is going to be on this call going, "What? Lucky lady!" I know, it's amazing. So good luck with that then, Fiona. Anyway, Rose has come back, so she was going to call us. We knew that. Leanne's come back again. We're doing very well. Lyra gained 35 grams a day over the last week. Woo, woo.
Brilliant.
She's getting much stronger and more efficient at the breast. I know we've got a long road ahead, but I'm desperate to move to exclusive breastfeeding and drop the top-ups. But combo feeding is working for us at the moment. Thanks for all your support. Yeah, keep going one step at a time, Leanne. Little Lyra was not sure about milk removal in the beginning, so if you're managing to do that, you've done a brilliant job, come a long way from when we met you upstairs. But that's really good. Keep going.
You can always challenge one of the top-ups when you have most milk in your breast. So first thing in the morning, you could feed and see how long she goes without asking for a top-up if she's settled. And then feed her again and then top her up with a top-up and just see what happens. That could be the first step to not topping up if she's gaining 35 grams a day. That's really good weight gain. So you could challenge it a little bit and just see what happens, because she will then be driven to feed more frequently. And I think with topping up is that, if you give larger volumes, they become in the bottle feeding model rather than the breastfeeding model. And a baby that is breastfeeding may feed more frequently in the daytime, so may feed, snack and do lots of little feeds, whereas a bottle-fed baby will have a larger volume and feed less often, so more 6 to 8 times in 24 hours, whereas a breastfed baby is 8 to 13 in 24 hours. So if you wanting to get back onto that model of the breastfeeding, then challenge it and just try once when you're feeling confident and everything is okay and she's peeing and pooing and her weight gain is good. Just maybe see how long she'll go. Give her a breastfeed when you think you're really full, usually first thing in the morning, and just see how well she feeds. You could do some compression to give her a little bit more so that she gets a really good feed, and then don't top her up. And then see how long she'll go in the day, between those two feeds. If she wakes up after about half an hour, she's probably not ready to do it. If she goes an hour and a half, that's probably fine, and then feed her again and then top her up. So you're just dropping one top up and then see what happens. Check her weight, check her poos and pees, check all of those things to see if she's okay. And that's the first step to getting on to not topping her up if you want to do that. You don't have to do it. If you're happy with your feeding as it is, then that's absolutely fine. But if you want to start dropping a few, that's probably the way to do it in the early days, just to see how long she'll go without having one top up when you've got the most milk in your breast. And
yes, so the time to do it is not the evening.
It's not the evening, no, because she'll be, eating her fingers. So, try when you're really full and see how long she'll go without another top up, and then top her up after the next feed as normal, and then top her up for the rest of the day and see what happens. Because it just sort of normalises feeding so that she becomes more like a breastfed baby if you're wanting to work towards that. But you don't have to do that. There aren't any rules.
I know. Leanne would love to be doing it, but it just wasn't an easy start.
Yeah, so, challenge it and see what happens. Just do it once and see what happens.
She's come back. She's definitely more settled after a breastfeed than she was, and often can't manage the top up, so I'll give that a go. Well, that's good news in itself, Leanne. Well done.
Fabulous news.
Lovely Lyra. Charlotte's come back on. She's giving us another update. I love Charlotte's updates, they're great. So she's had both her COVID jabs, that's great. Alicia's loving her full fat milk. She's just gone on to that, hasn't she? That's incredible that she's now having that. And she's getting much better at solid foods. And they're off to Devon, and that they're going to go and see Charlotte's mum. And they're going to the beach and go swimming. And she's probably going to probably have a few tears, as she hasn't seen her mum in ages. And I think that's heartfelt, Charlotte, because I think there are so many people who are in that situation. Yeah, I think so many grandparents. When we sit in clinic and talk to people, and you find out that I've had one in clinic saying their daughter was 5 weeks old and met their aunt for the first time today. And that's tough, isn't it? Who would have thought we'd have been in this situation, that you can go months and months and not see each other, but hopefully we're coming out of it. Fingers crossed.
I hope you've got a fur-lined cosy.
I know.
It's not warm. It's a windy, cold day.
You like your cold, wild swimming,
don't you?
I don't think
little babies do.
No, but you've got on those special jackets, haven't you?
Fur-lined.
Right, well I think that's it on the questions at the moment. This is going to be a flurry. We're 3/4 of an hour in, so we have got a few more minutes if you've got any more questions. But covered all sorts today. We've covered positioning and attachment, solid foods, nipple shields. What else have we covered?
Well, we can carry on with our care plan, can't we? Just to let you know what's happening in there. So this is getting towards the middle. I think it's probably the middle page, and this is quite crucial on the ward when you first have your baby, or when you have your first appointment with your midwife if you've had your baby at home or whatever. There is a question about whether they've watched you breastfeed your baby, and they have to sign it and say they have. And that means that they watch you put your baby on, and then they come back and ask you how it went. They don't have to sit and watch you breastfeed from the beginning to the end. So they is the staff on the ward, or your midwife at home with you. So that might be someone who's in a sort of bright blue uniform, sort of a mid blue uniform, which is a midwife. We've got nurses on the wards too. They wear white tunics or dresses. And we have the lot in our lovely MSWs, maternity support workers, are in pale blue. So a lot of the breastfeeding support is done by maternity support workers, and they get lots of training with us and spend a lot of time with us. Everyone is trained to help you with feeding, and if they feel that they need more support, then we get rolled in. So you shouldn't really see us.
We always say that, don't we?
We hope you don't see us, only on this screen, because if you do, then it means that you've probably got problems. It's not something we would come and, if you've got sore nipples or you're not quite sure how to hand express, it's not something that we would get involved on a day-to-day basis on the ward, unless you've got other things going on in your life. So you might have got medical issues, or you might be on medications. Your baby may have had problems, or you may have had really severe problems. You might have breast surgery, something like that. So that's when we get involved. So we don't expect to see you if you're normal and in the first early days. If you've come back in from home, we usually do get involved if your baby's lost a lot of weight. And all of these things that we're doing is we're trying to stop your baby from losing a lot of weight. We're trying to get you to be responsible for your baby and recognising when they're not doing what they should be doing. And part of it is that you get support to have a baby attached to the breast. So, not everybody gets even that far on the ward because you want to get home quickly, or your baby's not ready to feed. It might be that you had an instrumental delivery, you had an epidural, you have medications, and your baby's sleepy like you. And often babies don't wake up well and feed well for the first 48 hours if they've been medicated. And it's normally as you're going out the door that they start to, grow horns and want feeding more, and that's where your opportunity to have help is not so available if you've gone home. So if you are struggling, see if you can get an extra couple of hours with us, just to see if we can get that baby, your baby, attached to the breast with you.
Yeah, I think that people are often in quite a hurry to go home, but actually, breastfeeding is a learned skill. I always say to the mums that I meet, you don't get in a car and know how to drive, you don't put a pair of skis on your feet and know how to ski or whatever. You can't. They are skills that you're learning, and there's two of you learning. That's why we use the analogy of a dance partner, because there's two learning together. So it doesn't always work, and it might not be you. It might be the baby, or maybe that you're struggling with positioning attachment. So there's such a combination going on that please don't be in a hurry. If you're watching this and you haven't had your baby yet, come in with the mindset that you want to try and get feeding going as much as you can, not to try and get out.
Help.
Yeah, not to try and get out of the door as quickly as possible.
It's quite hard to access help, isn't it?
Yeah,
Once
it is
you get out
still.
at the
It's
moment.
still. You know, we are the only people offering face-to-face breastfeeding support at under 6 weeks. The health visitors are, but that's over 6 weeks. You know, Oxfordshire Breastfeeding Support, the Lecce League and Abingdon Baby Cafe are offering support, but it's online. You know, so, you know, make the most of being here. Come in thinking, I'm going to get breastfeeding to a really good place before I leave. Now, sometimes mums are still expressing and babies aren't attaching, but we'll have a plan in place. But try not to rush out the door without having a plan in place for how you're going to deal with it.
And they will write the plan here. So midwives should be writing there. And if you've been in hospital, there should be a plan when you go home if you've had problems, so that your community midwife can see what's been happening when she takes over the care at home, because this is all she can see when you have had your baby, because all your notes stay at the hospital once you've had your baby. So the other thing we do is see if you know how to hand express. So if no one's shown you how to do it, don't go home saying nobody showed me. Can somebody show me? Ask them. Ask them to show you how to do it.
So important to know how to hand express, because it's your first aid. This is what we tell parents, is why you should know about it. If you go home and your baby is not attaching, or your baby is fast asleep, and you think, it's been quite a while and this baby needs food, and if you don't feed your baby, then actually their risk of jaundice is going up and up and up, and their risk of losing a lot of weight is going up and up and up, and you're going to be more likely to be coming back in. So that you've got a baby that's fast asleep, or a baby that's screaming so much you can't get them to attach. If you can hand express, you can feed your baby. You can feed a sleeping baby with a syringe gently into their mouth, encouraging them to swallow little bit by little bit. Yeah, just with colostrum. You can calm a screaming baby and maybe pop your finger in and get the colostrum on your finger, or get them to lick off a spoon. You know, so you can do that. So there are ways of getting a baby to feed. And also, when your milk comes in between days 3 and 5, many women suddenly find themselves so full that a baby that's been attaching up till then can no longer attach, because that baby is like, oh, what's happened here? This really hard, full breast, and they just can't get on. So if you can hand express a little bit off to make your breast soft, the baby can then go on. So it really is your first aid. So please don't leave your birth environment, whether you're in one of our midwifery-led units or you're here at the John Radcliffe on the Spires or on level 5. Don't leave until you know how to hand express, because it really will be your first aid. And that's why it's in this booklet, because we need to know that you are able to, or know how to position and attach, and you can hand express, because it's your first aid.
And remember these numbers, you've got access to that, but also on here there's the Horton maternity unit, which is at the bottom, so it's not your Horton community midwives, it's further down, it says Horton maternity unit, and that's the MLU, the midwife-led unit, and that's 24 hours a day, so you can call, if you live in the north, sort of Oxford North, you can call them, and if you live Oxford South, you can call Wallingford community unit, and the numbers are here. And you can call them 24 hours a day. So if you're struggling at 2 o'clock in the morning, ring them. And you could always get in the car and go and see them and have your baby fed there if you're struggling.
And they've got the capacity.
And they've got
because obviously they're birthing units.
Yeah,
if they're full, they're full.
They say no. But if they say no, they genuinely cannot do it. They are really busy and they're with women in labour. But they can still give you advice on the phone, even if they can't see you face to face.
Get you through to the next morning and get the support that you need.
Yeah, absolutely. And also on your care plan page is our contact details as well. So the number for the infant feeding team is just along here. And so you might want to take a photograph of that, because this goes after 10 days. So if you're not sure, you can always take a picture of that. And then you've got a picture of these numbers as well. But your midwives discharge you after about 2 weeks. So your health visitor will take over your care after about 2 weeks, 10 days. So it's always useful to have numbers that you can contact. But so you've got lots of space there to make plans each day, and the advice you get will change frequently. So the advice you get on day 0 is going to be very different to the advice on day 1, 2, 3, 4 and 5. from about day 5 onwards,
You know what we haven't brought out today? We haven't brought out the stomach sizes. It's got to be about the first time ever.
My lord, let's do it then, quick.
And the reason I say that is because we get told that it comes back to us. Lots of you feed back to the Oxfordshire Maternity Voices Partnership, and one of the things we get told is, I got conflicting advice. And this is where this comes in, because if we think about the stomach the size of this, that's your newborn. By the time you go on to your day 3 baby, it's going to be on the bottom, we're talking about, this one. And when we're getting up to a week and beyond, and we're up here. So you can see that there is a huge difference in stomach size. So when we say to you, 0.1, 0.2 of colostrum a few times in the first 24 hours is fine. It is fine because the baby's stomach is tiny. By day 3, we're wanting to give way more food.
So 0.1, 0.2 is that much?
Yeah, and that's a 1 ml syringe.
That's a 1 ml syringe, and it's that much. That much. Tiny, tiny bit. That's okay for your baby. It's full of calories, full of fat, full of everything for them, and that goes into that tiny little space. And then as your breasts start to fill on day 3, and from day 0 onwards, as you do lots of hand expressing, you start to make more, and it goes up a little bit. So you might get a little bit more, and then it goes up. And you might get a mil out on day 0, but not many people do. It's nearly always tiny little bits, and it's probably technique rather than the fact that you don't have it. So if you're not getting anything out, get help.
Yeah.
Get somebody to show you how to do it, because that makes all the difference. And it gives
if your
you
baby's
confidence.
going to the breast, because everyone says to us, do I have to hand express? If your baby is going to the breast and feeding well and pooing and peeing as appropriate to their age, then we don't need you to be expressing. But expressing is your backup for anyone who's struggling, and making sure you have a milk supply. Because one of the things we always talk about is you only get as much as you ask for. So if you don't ask for it, so if your baby's a sleepy baby in the cot, not waking for feeds, and you're not hand expressing, you won't have a milk supply. It's as simple as that.
And if you don't have a milk supply, then the next thing we do is get you to have a look at these on day first 72 hours when you're in hospital. The staff should do this with you. They may do it without looking at it because they'll ask the questions, but you can look at that. This is the coloured stripy page, and this asks all the questions about whether your baby is peeing, pooing, happy, feeding, how they're behaving at the breast. Are they crying? Are they not going there? How they're suckling, so are they doing like nice big deep suckles, or are they nibble, 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 nibble coming off? How long does the feed last for? And do they come off spontaneously and let go? And what does your nipple look like at the end of the feed? Is it squashed and white or bleeding? Because that's really, really bad news. Do you know how to use a teat if you're bottle feeding? And if you tick all the boxes in the green area, and it gives you the answers there, it tells you an awful lot about what's happening. These are your 4 reliable signs: suckling, swallowing, peeing, pooing and weight. That will tell you how you're doing. And if you're ticking all those boxes, you should be ringing your midwife, even if she's not coming for 2 days. Mm-hmm. You should be ringing your midwife. Or if you think that's all happening on the ward, you should be saying, can I have some more help? My baby's not doing what it should be doing on this bit of paper. Because we do still have babies losing weight when they're inpatients as well.
So losing government terminology, green is great, so that's your Portugal and Israel. You can go on holiday there. That's going really well. These are your ambers. So these are your France, Germany, all the other places we're not meant to be going on holiday to.
Go there.
So this is your alarms. If it's in yellow, get help. If
Danger.
it's in green, marvellous. So just like the government.
And then this is after the first 72 hours, and it should be done at least twice up to day 5. So but you can do it every day, twice a day.
Yeah.
It doesn't matter. You can do it on yourself and work that one out. Okay, so just look at what's happening. Look at the questions. Look at the answers, because the answers are there. And if you're saying yellow, 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 then you should be talking to somebody. You shouldn't be sitting there and saying for 2 days, well, I didn't want to bother the midwife. She was a bit busy.
Bother them.
That's what we would be out of a job if we didn't have you. So remember that. So these are really important things for you to notify us if you're worried about them. Because the last thing you want to do is come back when you've gone home. The last thing you want to do. So
So Alicia's come back actually. She's gone, thank you for the tips. I've tried skin to skin, so she was the lady using the shield. And the laid back position to see if the baby can find the nipple herself. She licks, the milk starts coming out, but she gets frustrated and can't latch. I don't want the breast being an unhappy place, so I put the shield on and feed with it. I'll give your tips a try. And
try syringe.
Yeah, and I think you're absolutely right. The minute she starts getting upset, stop. Do something else.
Yeah.
What we do not want are babies that are literally brought down to the breast, whatever way you're feeding, and they start to scream and shout, because you end up with a baby that's breast refusing. So we want your baby to always think of the breast as a really, really nice place to be. So it's a positive experience always. So by all means try her, but if she starts to get upset, stop, change what you're doing, try again later. So and that's what you've been doing, Alicia, so well done and keep going. Hopefully it will happen, but remember,
but it's their terms.
Yeah, and remember you are breastfeeding. She's a lucky baby to get your milk. Many babies are not that lucky.
Every day you give your baby milk is a bonus.
Yeah.
Don't ever forget that. You
It's
haven't
fantastic.
failed ever as a breastfeeding mum. Never, 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 never.
Charlotte's come back. She said Alicia's making her laugh, but she's trying to give us the Peppa Pig cuddly toy through the screen. Thank you! I have another question. It may sound silly, but if I have another baby next year and I had a suction cup on her head with Alicia, would that stop me having a normal birth? No, not at all. So you had what we call a ventouse delivery, so that is the suction cup helps bring the baby out. It's the alternative to a forceps. And it usually means that the baby's in a better position and it was going to be a bit easier to lift out.
Yeah.
So that would not stop you. And the fact that you had what's called a vaginal birth, Charlotte, means that you're in a really good stead to have another vaginal birth. And normally, and I know there's going to be a round of people out there who've had second babies, including my sister, normally the second baby comes much more easily. Quicker labours and second stage much quicker. It's like the body goes, oh, I remember what I've got to do, and just gets on with it. And also thinking about milk, second time round, for those that are breastfeeding and everything, is that the second time round or subsequent mother, the milk tends to come in a bit sooner and it comes in bigger quantities initially. So for those of you who have struggled this time, just give heart to the fact that actually next time the milk will be in a bit quicker, you'll get a bit more milk, and everything you've learned means you'll be that much further up the ladder on your learning experience.
You've got more skills.
Yeah.
You've got so many more skills.
Yeah.
Don't forget that you also get this book when you go home too, and you should get this at your 36-week scan. So if you're coming up to have your scan, make sure that they give you one, and if they don't offer you one, can you ask for it?
Yeah.
That will give you lots of information before you have your baby to prepare you for when you have had it, and then you get another copy when you have had your baby as well, so that you really know what's happening, and that's your go-to, and it tells you everything that we've talked about today. It's got lots of information.
I will say, for the sake of paper and trees, if you can lay your hands on the one from 36 weeks, then do tell the staff on level 5 that you don't need it, because then we won't have to print so many. So, and in sort of, with regard to that, that's the breastfeeding booklet that's done by Public Health England, and we also, in conjunction with UNICEF, we also have one about bottle feeding.
So if you're giving bottles and breastfeeding, you should get both.
Yeah, and if you're just bottle feeding, you should have this one. And it has all about safe formula preparation, responsive bottle feeding, how to make up feeds when you're out and about, because obviously we have to be very careful with regard to it, because there's much higher risk of a baby having an upset tummy when they're formula fed than a baby that is breastfed, just by the sheer nature of the milk, and having to keep everything clean. And remembering that formulas, we should be telling you this, that formula milks are all the same, that there is, if you buy one brand versus another, they're all going to have the same nutrients. It's by law, they have to be the same. So you can buy an expensive brand, you can buy a much cheaper brand, but actually the nutrients are the same. So in which case you could be saving your pennies and be like Charlotte and go on holiday to Devon. So, go or to Portugal, which is probably another place you'd like to go to. So you could be saving your pennies to go and do those things. So, you don't need to buy expensive brands. They do not have anything in them that is necessary in comparison to anyone else. They are all the same. And you only need first stage formula for the first year of life. So if you just think first stage for first year, follow on milks, growing up milks, colic, reflux, all these milks, unless indicated by a GP or a health visitor, are all marketing ploys to get a bigger market share. So actually, you don't need to go and buy Goodnight milks, milk for hungrier babies. First stage milk is the only milk needed for the first year of life, and you can go and buy a supermarket branded one, and it will have all the same nutrients as any that you might see advertised on the television.
And follow-on was just introduced so they could advertise it on the television, because it's against the law to advertise first milk on the television or anywhere else, because it's for babies up to 6 months. So it's the same. It's just that they branded it differently so they could advertise it after 6 months. So it's fine to just use the same milk all the time.
Absolutely. It is a way of getting around a loophole in the law. It is because they can't. The formula milk companies are not allowed to advertise formula milk to newborn babies, but they are to babies over 6 months. So that's why they do it. I can see we've got one more question snuck through, and I have to do it on the phone because my laptop has finally given up. It's not done badly. Right, so Holly has said, hello, I breastfed my son for 2 years and I'm planning to do the same this time round. I started trying to harvest colostrum but not getting anything. Is it worth persevering or waiting until the baby's here? Supply wasn't an issue last time, just poor latch due to tongue tie, which was snipped at 4 weeks. 4.5 weeks, in fact. You can just get that skill. You don't have to collect it. I mean, if you did well last time, no need is there. I see you shaking your head. So just say, don't worry. As long as you've got that,
refresh it again in your mind. Do a little couple of goes, and then don't worry.
And as I said, this is a second baby. It's not that long ago, 2 years ago. So your body will remember what it's doing, and that milk will come in quite nice and quickly.
What we do find with second-time mums that breastfed, well, is that they end up, look, we've got a drill, just so you're feeling a bit that you've been left out.
We have a drill every week.
You've got used to it now.
Yeah.
Is that you feed a toddler. So you remember how you finished feeding, and actually you've got to go back to basics again, otherwise you get yourself in trouble. So make sure you tuck your baby in close, and you do all the things that we've talked about today about, lining your baby up nose to nipple and all of those things. Don't just sit cross-legged on the bed with your baby across your lap and its feet towards the bottom of the bed, because you will be in trouble. So put your baby close, go back to basics, make sure your baby's feeding properly, because you'll be in trouble in a couple of days if you do that. You'll be sore. So it's a different baby, different pregnancy, different baby, different breastfeeding, everything's different. So treat it that way and not imagine that it's going to be the same. Bring them in
round the contours of your body, get that chin in.
Yeah, it's the thing that most people do with subsequent babies.
Have them hanging off.
Have them hanging off and think they can just bung them on and keep chatting, and then suddenly 48 hours later they're curling their toes. So
the baby's not gaining.
Or the baby's not gaining weight. So you've got enough to do looking after a toddler without having problems coming to clinics and talking to people about positioning and attachment, when you really just got to tuck them in and work properly with them.
Right, I think that's our last question, Holly. Thank you very much.
We are.
There's no reason not to be here. So thank you very much for all your lovely questions. None of them were silly, they were all great. And I'm sure that if you thought yours were silly, well, there goes the drill properly now. That's cue to stop. That actually there were other people thinking the same thing. And just to remind you that our videos are up. We're not, as we keep telling you, they're not award winning, but they are useful. And I was talking about hand expressing. Go and have a look at our videos. So there are
real life hand expressing.
And you'll see other members of the team on there as well. And you'll hear the lovely voice of Sarah, who does all our voiceovers. She's one of our team as well. If you want to look for them, you just do a search. You can go on any search engine, OUH, as in the hospital, OUH, maternity feeding, and it'll go to our page. And there's a link, and it says maternity series, and there are 7 videos on there. Have a lovely week, and we'll see you next week.
Don't get blown over. Mind out for the trees.
All right, bye.
Bye.